Okay, there we go. We're live. Hello, everyone. Thank you for joining us today. If you're watching this, you're joining us as a part of Bloom, our new and expectant parent event online this year. We're meeting virtually, which is amazing because then we get to meet with experts like I have here today live from their office. So I'm going to introduce you to some pediatric dentist friends of ours from myKIDSdds, and they have some parenting tips for everyone. And it's on an interesting topic that I think a lot of expectant parents and new parents may not know about. So I'm going to introduce you all to the dentist from myKIDSdds. Why don't you tell us your names and who you are and where you're located?
My name is Alex Villaseñor. I'm a pediatric dentist. I've been with myKIDSdds for many years. I've been practicing in Dallas. I practice in Baltimore, in Colorado, but my home is myKIDSdds. I've been here for a long, long time.
And Nima Dodd, very nice to see you all. You know, we can't really see you all there, but we're glad to be with you. I practiced in Connecticut for a few years, and I'm originally from Texas, so I'm back home and loving the state of Texas. Although I will say I expected more sun right now. At the time of this recording, it's cloudy. Hopefully it's sunny when you guys get to see this.
It is very rainy for the month of May. This is crazy. So I think a lot of expectant parents, those who haven't had their first yet, as well as some new parents, may be a little surprised to see us interviewing some pediatric dentists, because I think most parents will think, you know, I don't really need to see a dentist until my kids' teeth pop in, or if I have some issues with their teeth. But as I've learned from you all, from being a patient with myKIDSdds, there's actually a reason that parents might want to consider pediatric dentistry without even thinking about the teeth. Do you want to tell us a little bit about what that procedure is?
Of course. Based on what we have noticed in pediatric dentistry and in medicine in general with children's teeth, is that the old recommendations of children coming to the dentist at 3 became 2, and now is by age 1. Reason is, if we can see children that early, dental decay is a preventable disease. So there's a lot of counseling that is going to go into, implementing preventive measures, identifying risk factors. Some parents are prone to decay, and that can be transferred to the child at an early age, so we can do an analysis on that. We're also going to talk about habits, pacifiers, nursing, eating, speech issues, soft tissues. Kids can have abnormalities on gums and teeth that we don't want to wait too long and then have a bad outcome. Breathing, there's so many things that we can look at other than teeth. I mean, teeth is the main focus, but it really is, the mouth is going to be the gate for the overall wellness of the child and the individual. So we want to start early.
Yeah, I think it's important to emphasize what Dr. Alex just mentioned. The key, for us at myKids, and really moving forward, I think in healthcare in general, it's this idea of promoting wellness. Mm-hmm. And that starts at a very, very young age. The American Academy of Pediatric Dentistry recommends the first visit for a child to be by their first birthday or within 6 months of the first tooth erupting. And so that's an ideal time for us to see the kids for the first time. And like Dr. Alex mentioned, a lot of it is really discussing what to anticipate, what to expect for the child when it comes to teeth. But also it's a kind of an educational platform. It gives us an opportunity to discuss with parents, what are some tips and tricks when it comes to brushing, mm-hmm. my kid's teeth. Most parents come in saying, it's a battle every single time I'm trying to get in there. And we want to make sure it's comfortable. We don't want it to be a scary thing that I have to brush my child's teeth and it's, a source of anxiety in the morning or at night. We don't want that to be the case. Our hope is to help parents figure out ways to establish good routines as well, so that it makes their life easier moving forward. Everyone already has enough on their plate, and our hope is to establish a dental home for the kids and make it a smoother process for the families as well.
Another
go ahead.
Is emergencies. What to do with injuries? Little ones are going to trip and fall and break a tooth and have injuries, as we know, Crystal. What to do. I want parents to be prepared, what to expect if this happens, how they can find us, how they can reach us, what can we provide in the moment of an emergency. There's some things that need to be crucially done within certain times. Some other times things can wait. And just to help parents kind of understand and what really is what to do, which is a big question when we have a little one with an injury.
Yes. Yeah, of course, no one knows this, but a week before my youngest son's first dentist appointment with you guys, he fell and broke his tooth. So I was really glad I knew exactly who to call. I didn't have to think about it. I knew it was a dental emergency, and I just picked up the phone, so it made it really nice. So one of the things you mentioned is sort of those unexpected things as a new parent. Obviously, breaking a tooth, things like that is very unexpected. But even long before the teeth come in, I know that you guys work with lactation consultants because there's a really big issue, I think, that happens with nursing parents that they may not realize.
It is so true, and thank you for bringing that up, Crystal. We want babies to be able to nurse, and mommies to have that opportunity to nurse is that their choice. Nursing, breastfeeding is real different than a bottle in the sense that the anatomy of the breast is different than the anatomy of a bottle or a nipple in the bottle. And that is going to help the overall facial development of the child. So if that can be promoted, that will be great. I know there's circumstances where a bottle is the only way to feed a baby, and that is totally okay, of course. But we want to support nursing. So these tissues, maybe Nima, you want to elaborate on what how frenoms interfere with nursing.
Sure. So typically when we think of the frenum, we think of the lip or the tongue. So we most commonly hear, I have a lip, my child may have a lip tie or a tongue tie. There's actually 7 different frenum in the mouth that we have. Some attached to the cheeks, also on the lower lip and other places as well. And so the thing to remember really is we all have this. This is all part of our normal anatomy. So it's not to say that because you have a frenum, then you need to have some kind of correction of that. The key is to determine, is there or is there not a functional issue related to that frenum? So functional issues may include nursing, like Dr. Alex is mentioning, and that's typically what we see with infants, the younger, kids that are a few months old who are at the age to be breastfeeding and nursing. As kids get a little bit older, those functional issues may change and become speech related. They may become feeding related. And so one of the things that I like to stress is we don't go based on the appearance of the frenum. It's not just the fact that you have one or the appearance of it. It really comes down to, is there a functional component that needs to be addressed and corrected? And that's where we would love to work with a team. It's a team approach. And I know you mentioned lactation consultants at the beginning of this question. It's all about how do we work across the aisle with our consultants and therapists in order to determine what the best approach is for the kids.
So what does that procedure look like? I think it's called a frenectomy.
It is called a frenectomy. We are fortunate to have a really amazing tools now. We have CO2 lasers. We've been using lasers in our office for a long time, 10, 12 years. And lasers have been evolving. But now we have this last model that is so wonderful to use. It is an invisible light. It practically vaporizes the tissues so that we can remove these frenums, release the restrictions so that the lip can move and do what it's supposed to do for a good latch, and the tongue as well to be able to move and sustain that elevation that the tongue needs to have inside the baby's mouth. And if there are other ties, buccal ties are called on the sides of the cheeks, if it is necessary to release those, we do that as well. The beauty of this procedure is that it is fast, is very well calibrated, although it's still a surgical procedure. It is very safe. We have techniques that are designed for newborns. Calibration of these instruments are specific for tissues. And the best part is that it cauterizes, it closes vessels so the bleeding is minimum. It sterilizes the wound so there's no chances for infection. So in a matter of seconds per site, these tissues can be released. And then the hope is that this is going to allow the baby and mommy to have a much better relationship, a much better nursing experience.
So I know one of the questions a new mom might ask is, oh my gosh, I don't want to put my child under surgery. You mentioned it's calibrated just specifically even for newborns. Do they have to worry about, it hurting the baby, or is there any concerns that they should have that they would stop them pursuing this type of procedure?
So one of the things that I wanted to mention is that, frenectomies have been around for a very long time. Back in the day, if you had a sharp nail and the child was born, sometimes the midwife, I believe, would just clip it with a nail. That was kind of fast forwarded into using scissors and scalpels, and there's many ways to approach doing the frenectomy. And really, the gold standard is using the laser. Ultimately, yes, you are. It is a surgical procedure, and ultimately, yes, you are creating a wound, and so there is going to be an element of discomfort. So, a lot of parents will come and ask, "Is this going to be pain-free, or is it maybe uncomfortable for the patient?" And that's something we love to be transparent about. There's a wound that's being created, and so it's important to keep that in mind. But the procedure is done in a way with the laser where it's essentially heating up the tissue to boiling temperature, where it just vaporizes the water, rather than using something sharp like scissors or a knife that could potentially cause more harm when the child is moving around. And so, is there something you wanted to add to that? Or
so the beauty of having lasers, we can do. They're also good for hard tissue, meaning we can fill cavities using this laser. And it uses water when we're using a cavity. It doesn't use it for soft tissue when we do a frenectomy. But the beauty is that the child doesn't need an injection, so we can treat and do a filling without the pulp, the internal part of the tooth, feeling pain. Babies they don't like the exam. They're little. They don't like to be touched with their mouth. But even if the procedure is not creating pain for the baby at the time, we tell parents we are creating wounds that will become uncomfortable in the next few days. And the procedure, again, is very fast. The biggest challenge, just to be transparent with parents. And the key to success is that we're going to teach parents how to manipulate the tissues, move them around away from the wound, or so they won't heal back together and reattach. And that is done quite frequently, and is done for a couple of weeks. So that is the biggest challenge for a parent, because they need to do those in order to keep the wounds optimal. But there's a learning curve. We'll teach them how to we demonstrate all these. But overall, I think the procedure itself is not the one that is most uncomfortable. I think it's the postoperative care that may be more challenging, but really important.
Right. And as you said, it's so fast how quickly you guys do it.
Right.
But I've also heard from other new parents who've had this procedure done before that the results are almost instant. I mean, not literally instant, because you want to let it, heal for a little bit. But I've heard nursing results are it's like night and day for a mom who was having such a hard time nursing, and then all of a sudden the baby knows how to latch, and it's like night and day, and it's such a dramatic improvement.
That is so true, and it's very rewarding to be able to see those results. However, everybody's different. I don't want to lead other families or mommies or babies that don't have immediate results. The child may be a little bit older. The circumstances are very different. So there's other factors, but it's true. We do have so many cases where it's immediate change, night and day.
So you touched on this a little bit, but if a parent does suspect that they may have a tongue tie or a lip tie, what are some of the things that you might look for, both in maybe a newborn as well as maybe an older child?
So if a parent suspects a child has a lip or tongue tie, it's important to first categorize them by age. You know, how old are they? If we're looking at infants, then is this a breastfeeding or a nursing related issue that we're trying to resolve? If that's the case, our approach has always been to have an inclusive team approach whenever treating kids for lip or tongue attachments or ties. And so it would be, the first step would be, let's have a lactation consultant take a look, make an evaluation. You know, are there ways the child can work with their current anatomy? And are there ways that, you know, it can become functional through the therapy and advice from the lactation consultant? If so, fantastic. We took care of that right then and there. If that's not the case, then the lactation consultant will typically make a referral to us and send the kids our way to do an evaluation of our own. And most of the time, that evaluation really starts with a conversation with the parent and really a thorough history of what's going on, what's happening. You know, what are some of the symptoms that mom is experiencing, and what are some of the symptoms that the child is experiencing? All those become important for us to be able to properly diagnose what's going on in order for us to make a proper recommendation of whether or not to make the release.
Yeah.
Right. You know, things that we look at to be specific, you know.
Sorry.
All right, it's all right. A poor latch. And what a poor latch for the baby looks like, leakage, clicking when they're nursing, when they're latching, the lips so that they're almost biting, and it becomes very uncomfortable for mom. They could be swallowing so much air because the latch is so poor, so they're gonna be gassy or colicky, or even in other cases, even having really significant reflux. And the transfer of milk is not appropriate. So moms are not fully drained, having that leads to mastitis or leads to a latch that is so poor, and the baby is trying so hard that is incredibly uncomfortable for mom. So those are like, in some, especially first time moms, sometimes they later they say, especially if they have a second child, I thought this was normal. I did not know this was normal. Or the fact that they couldn't nurse at all, they thought it was just their fault, or it just didn't happen until, you know, we identify these issues, and then we can you know, help them correct. But in early age, in infancy or newborn, that can be the case. As they get older, then they have issues as they're not eating well, they may be not swallowing properly, they may be not interested in biting food because the frenum, the tissue on the lip, is too painful. They don't want to bite on food. They start pushing food away. Now we're seeing so many children that are of any ages that have feeding issues, feeding disorders, like feeding therapies, and typically the first thing we need to do is evaluate these tissues. And that can go as of articulation. The kid can be older, starting to talk, and we cannot understand what they're saying. So it has multiple tiers of, or the shape of the teeth, the way teeth come in. Sometimes they come in with a huge gap. By then, children may be 5 or 6 years of age. So frenums have a real complex role in the child's, you know, development, growth and development.
So would you recommend, and I know you say you work with several different types of different people, different consultants, if any of those symptoms that you just described, having trouble eating, having, you know, talking issues, would you recommend perhaps investigating into lip tongue tie or other things like that first?
Yeah, it's important to explore that, absolutely. And Dr. Alex mentioned this earlier as well. Not all releases result in a resolution of what's going on. There could be other factors at play. There could be neurological factors, the connection between the mind and the muscle, neuromuscular issues that are at play. And so it's important to consider that as well. That could be a possibility. But if parents are suspecting that their children are having issues, once again, depending on what age they are, then it's highly recommended that they visit a pediatric dentist that can evaluate their lip and their tongue, and also ask questions that go beyond just the teeth and go beyond just those attachments. I think what we've alluded to many times is that, you know, this is just a piece of the puzzle. There's so many pieces, and really, once again, our goal is to promote wellness. So if you look at a tongue tie, for instance, that's restricted to the floor of the mouth, many times those kids haven't had an opportunity to have their tongue lift and touch the roof of their mouth. What does that do? Well, that creates your palate is at the top of your mouth, okay? So that creates a more restricted palate, because your tongue, the pressure it applies, actually expands the palate. Now, what is the palate connected to? It's connected to the floor of your nasal cavity. It's connected to your nose and your septum. As you push, if you have less space, more constriction, you actually create less space for air to flow through your nose. So now you may have difficulty with breathing through your nose, and that becomes an airway issue. You see many kids who are mouth breathers. And so it's really investigating what's causing what. And unfortunately, there's not a simple answer to any of this. But really, I want to stress this, that our goal is to promote wellness. It's to look beyond the teeth. It's to help parents who are having difficulty with children who are nursing or who have speech issues. It's to help with guide parents with kids who have airway difficulties, and try to catch these things at an early age, and use our partners in the healthcare field, from therapists to ENTs, lactation consultants, a whole spectrum of really amazing people who we can partner with and team up with in order to create a positive outcome for the kids. If we can catch these things early on, then we're ensuring that they grow well and they're healthy throughout their lives.
I love that. So similar, the same way most parents already have established a relationship with their pediatrician, just for everyday wellness and health, they should also be establishing a relationship with their pediatric dentist.
I agree. And
yeah.
One of the things you were asking earlier with other specialties, some children that we encounter at times, they come to us at a certain age, but we learned that they have been in feeding therapy, for example, for 2 years. And nobody's looked in the mouth to see what is the restriction there. Or children that have been in speech therapy, same, for a year, and then we had a lot of change, but then nothing has happened. Well, let's look what is going on inside the mouth. What is that those restrictions creating? Or children that are so tongue-tied, or tissues in the throat are not really cooperating for their best. They're holding their breath, and they have sleep apnea, and they're not learning in school, and they're having ADD issues. So there's so much more, Crystal, like you were saying, to pediatric dentistry than just teeth. And so important to come at an early age.
It's more than just 32 teeth.
So since most of our audience today is new and expectant parents, but of course this is going to go live on our main page, so we'll have parents of all different ages, children. What would the next steps be? How do they get in contact with you? What do they need to do for the first time that they call? What do you recommend?
So pick up the phone. First thing is, and we understand that not everybody lives close to us, and they're not all in Dallas, I'm sure. And so
myKIDSdds.com.
myKIDSdds.com would be step one. Picking up the phone and just making that first contact with their pediatric dentist. Once again, we're here. We're here at the earliest. Kids who are infants to kids who are in their teens, and at any stage, it's not too late to start. Really, we don't want parents to think, well, I missed the opportunity to come. My kid's 4 now, so we should just, not consider going. At any stage, it's the best time to come. It's like the saying, I believe, what was it? The best time to plant a tree was 20 years ago. The next best time is today. It's just come on in, and we're here at myKIDSdds in Dallas.
Yeah, call us. Any questions, please.
Awesome. And we are going to encourage, and I'll actually drop the link right now, we are going to encourage parents to go ahead and ask questions down below in the comments. And I believe someone from your staff is going to be online available to answer those questions. So and of course, I think several of our team members at Dallas Moms are already patients of yours. So we're happy to also give experience from our personal experience as well as what we know about your business too. So we'd love to answer any questions or comments you have too. But of course, we'll always turn them over to the experts like you guys when we don't know. So thank you all so much for being here today and for talking to us about this, things that, like I said, I really don't think many new moms or expectant moms even have heard of those conditions before. So hopefully it helps someone, and hopefully they give you a call if they have some concerns.
Fantastic.
Crystal, thank you so much.
Thank you so much. We appreciate it.
Yeah. Thank you all so much for being here. And we will talk with y'all soon.
Thank you. Bye.